everybody. Dan Shinder here on Drum Talk TV, Drumming Injury Talk, and I'm all alone because Janice isn't here, but that's my fault. In fact, she's calling me right now, so hold on. Hi, Janice. Oh, good. Totally my fault. I'm actually live now. You could join me if you want. If you are, oh, okay, great. Here comes Janice, everybody. Okay, thanks. Bye. So what happened, folks, was some interlude music first. Never mind that. We're going to talk about some really neat stuff, and I have a story that goes along with wrists. Janice is going to join us in a moment. I goofed, and I thought we switched times with the news desk report, which is every Friday, which used to be at noon. So I thought we moved this show to 1:30. We moved the news desk to 1:30, and I got confused, and I led her off the path, and our producer, the amazing Steven Shinder, reached out and said, so you and Janice are about ready, right? Because he didn't hear from me. I usually tell him, hey, we're chit-chatting before the show. We'll go live in a moment. And he didn't hear from me. So here's the plan now. Janice is joining us. She'll be right with us. We're going to talk about wrists. I'd say wrists are as important to a drummer and pretty much any musician as their feet would be to a drummer. Anyways, if you're a piano player, a little bit, maybe, right? Flute player, not so much, but wrists, any musician really needs their wrists. And Janice always comes on board with a really neat program where she can break down the physical anatomy, zoom in, peel back tissue, muscle. You could see the nervous system if you want. You can see the vascular system if you want. You can see just the bones if you want. All kinds of things. There's Janice. Hey, Janice.
Hi.
Why are you
Hi.
late? I'm just kidding. I explained to everybody it was my fault. I forgot which show we switched with which. So I gave everyone a heads up on what we're going to talk about. But before we dive deep and talk about the wrists and wrist injuries, I want to share my story really quickly. So I have a picture to show, a couple of pictures. This first one, this is me probably a week after I got my first cast on when I broke my right wrist. Janice, which bone is this one, that pivot bone there?
That's your radius.
I broke the radius.
Was it in the wrist or in the hand, the wrist bone or the actual long bone?
Right there, the roundish
so probably bone. Like your scaphoid.
I broke that in half. Yeah, it was broken in half. Where'd that other picture go? Here we go. So this is me. I was 18 and ripped, I've been told. Now I'm 62
with hair
and a slub. You can see my cast there. And I say first cast because I went through like 6 casts. About another week after this, I went backpacking. And I asked my doctor, is it still okay to go backpacking in the high Sierras? We've been playing. He said, just don't fall off a cliff and land on your wrist. As soon as we got to the trailhead, it was like a cartoon. Big purple cloud had started hailing the size of marbles, and my cast got soaked. So I was in the high Sierras backpacking for 2 weeks with a cast that was just deteriorating. The elbow broke out, and so I got that switched right away. Eventually went to just half an arm. Here, not looking very happy. That's the day I came home before the drawings were on it. But then one day I was moving around like that, and my mom said, "What's wrong?" I said, "Nah, I'm just depressed. It's just And she said, "Why don't you go play your drums?" What? I looked at her like, "What?" She said, "You got your feet. You got one good hand. Go play your drums." So I went out and I started playing with just one hand. And I was already ambidextrous, and that really helped my ambidexterity. And Janice, maybe you can dispel whether this is a myth or what, but back in the day, that was 1981. That was 81. It was the summer right after I graduated high school. And milk does a body good, right? Milk builds healthy bones, right? I drank milk by the gallon, Janice. And this injury where the bone was cracked clean through. Initially, my doctor said you'll probably need screws. You better start learning how to write with your left hand and wipe your butt with your left hand. You'll never. My dad and I
were
like,
dramatic.
Yeah, it was. I was already a professional drummer. I started touring at 15, so I was freaking out. I drank milk by the gallon and it healed relatively quickly. I never had screws put in. Did the milk have anything to do with that, or was I just lucky?
It's hard to say. I mean, you definitely need calcium to build strong, healthy bones. Like that's not a myth, right?
And I have a hyperparathyroid, which means I've got like 4 or
Mm.
5 times more calcium than the average bear.
Yeah, so I mean, I think there's a lot of different factors of like why you healed so well, like age being like one of the big things, right? You were
True.
really young. And typically, most people, as long as the bone is aligned right, you don't have any other risk factors. Typically, the bone will heal well within 4 to 6 weeks. That's pretty standard.
Huh.
Um, Different than like you strain a muscle or you have some kind of nerve thing. Those are a little bit more gray. But
Yeah.
bone is like 4 to 6 weeks in a very typical situation. Should be like pretty set by that time, and then it'll continue to heal and remodel over the next year, but it should be pretty set after that
Oh,
initial
that's
4 to
great.
6 weeks. Yeah.
I was
Um,
super careful after that trip because that
yeah.
scared me being up in the mountains for that long with a soggy cast and but
Yeah.
let's talk about and folks, if you've had any bone injuries as a musician, talk about your experience and emotionally, what did that do? How'd you get past it? Did you stay positive? Did you go down in the dumps? Did you heal well? We'd love to know
Yeah.
your story, but how about some bone injuries, especially in the wrist that you've come across?
Oh, man, I mean, I think the most common one is, a broken wrist, and so it sounded like yours was in the wrist itself, but probably the most common bone to break in the body, probably is the radius, which is the long bone in the forearm on the thumb side.
Right,
You have
or
your
the
radius here
tibula,
and your Huh?
and maybe the
This
tibula.
this is the ulna here,
Okay,
um, but this is your radius on the thumb side, the long
got
bone
it.
here. Um, yeah, and so usually if people, like, fall out, like, you usually try and use your hands to kinda catch
That's what
yourself.
happened. I
Um,
fell 5 miles an hour on a dirt bike. 5 miles an hour, my back wheel washed out in the sand. I put my hands out in front of me and it popped.
ouch.
Yeah,
Yeah.
it was
Um, yeah, so probably that is one of the most common bones. The next most common bone is probably the fibula in your ankle, the
mm,
one on the outside of your leg, the
yeah.
small skinny bone. That's probably the next most common bone, if not
Wow,
tied or very close together. Um,
crazy.
so, and I think you said something really interesting as you were kind of like telling your story about like what your doctor told you and everything like that, how limited you were going to become if you didn't heal well.
Right.
Um, and that's one thing that I see a lot is like words actually matter. Like what someone with authority in that setting, you know, if they tell you, "Oh, you're never going to be able to play again," you're gonna believe like, your natural inclination is to believe them, right? Like,
Right,
you have a lot of stubborn people who are like, "I'll show them, I'll go back to playing," but
right.
most people, they listen to that, and whether that's true or not, like, that could have a huge impact on someone's kinda trajectory in terms of, like, returning back to playing or not.
Yeah,
So, I there there's so many different instances where maybe a injury is so severe that maybe that will limit them from playing, but it also maybe if it is that severe, maybe you don't play the way that you imagine yourself playing, but maybe there are other ways to go about kinda like what your mom was
right.
saying, you have 3 other working limbs, like,
Yeah,
why not
and this
go for
is
that?
long
So
before, Rick Savage had his accident, so
right,
there you
right.
go. She
So,
was like a seer, I guess.
I just wanted to say that because I have worked with so many musicians who have like, either a pinched nerve in their neck or tendonitis or what you name it. And I've had physicians, doctors tell their patients and the people who come in to see me that, you might as well just give up your music career now. And then some people have. One
Huh,
person I know was a very, very accomplished violist. And then her doctor told her something along those lines, and she switched instruments completely to electric bass. And she had a
wow,
career playing the electric bass. But then when I saw her, all she wanted to do was to go back to playing the viola. Like had, she had a very successful career as a electric bass player, but she was not old, but like for 50s, 60s, like kind of
Thanks for saying
in the
that's not
next.
old.
It's not old, but like in that new
It's not.
phase or kind of another phase of their life where they're,
Right.
just trying to look to get back to the things that they enjoy and whatnot. And she's like, I just really always wanted to play the viola again and at a level that I want to. And I was like, why not? Let's take a look and see what we're dealing with. And maybe you can't, but maybe you can. And maybe you. So,
Sometimes it comes down
it's,
to belief systems and like you were saying,
yeah.
frame of mind. And I think I took the position, like, I wanna overcorrect what it'll take, for this to work, and that there came the gallons and gallons of milk and really kind of babying it.
I mean, I would say that that didn't hurt, right? Like,
Right.
you healed really well. Like, so even
Yeah.
if it didn't do anything, it didn't do anything bad to your body,
Right. I didn't go backwards, you're right. It didn't
right?
break any further.
It didn't break any further, that's right. Yeah, so, I deal with people quite frequently because it is such a common area to injure is the wrist. And as musicians, we are very, like, upper extremity heavy, like, dependent,
Yeah.
right, with what we do, like, all the intricacies that our hands do for regardless of what instrument that you're in.
Yeah.
And so, that does pop up more often than not. So, yeah,
Interesting.
those are some really common things that I see.
Very interesting. Do you wanna show us, kind of break down the anatomy of the wrist and
Yeah,
literally illustrate those 2 main weaknesses that seem to be the common bones to break?
yeah. Let me see. Let me pull this up. Okay, here we go. Hopefully you can pull that
Yeah,
up, Dan.
there it is. Bang. There we
Boom.
go.
All right, cool. There we are. So what we're looking at is the arm. We have our forearm here. So we have a lot of muscles, and most of the muscles in this area here are the muscles or power generators that go into our fingers. So they
Mm,
help control our fingers. Um, if we're looking at the wrist specifically, so let's zoom in. So this bone here is the radius. So if you're looking at your palm facing out, the
yeah.
radius is on the thumb side of your forearm. And then this here is the ulna here in the green. So that's a longer, skinny, or it's a skinnier bone. And
Mhm.
that bone is really what makes the hinge of the elbow joint.
Oh, I see. Yeah.
So, I mean, both the radius and ulna kind of make the elbow joint, but this here is the pointy part of the elbow. That's what you're feeling is the
Yeah,
tip.
literally the connector, right?
Yeah, literally the tip of
Yeah.
the elbow here. So that's kind of how that all kind of connects together. Um, So we have that as like kind of the ends of the bones here is kind of like the first layer of the wrist
Mhm.
as it comes from our body. Then if you look in the hand, you have all these teeny tiny little bones, right? Uh, you have seven little bones. That's one, two, three, four, five, six, eight. Eight bones, sorry. Eight bones in the wrist that all kind of move independently of each other in some context, but they have a lot of play. So you can feel that in your wrist if you like kind of stick your fingers in like the crease of the wrist
Yeah.
here and you just kind of
Oh,
like
yeah.
move it up and down. You can
Yeah.
feel like all the little bones just kind of like shifting with each
Mhm.
other. It's not just one chunk. It's not like you have this joint right here and then your fingers. You actually have these tiny little bones in between.
And are they
And
basically free floating with bursa or other tissue separating them?
they all have ligaments. So
Okay.
let's see, if we add in the ligaments, you can kind of see how
Oh,
intricate
yeah.
that is. So each ligament is responsible for controlling that the bone doesn't shift too far one direction or the next. So you have
Yeah.
quite a wide range of ligaments kind of holding everything together as like the glue here,
Mhm.
right? Um, and then you get into the hand. So the wrist bones are mostly those tiny bones as they connect to the end of the forearm. So that's really what we think about when we're talking about the wrist. If we talked about nerves before, right? So
Yeah.
if we go back to that discussion just really briefly, if I hide this, if you're looking straight down, you see this area here. Hopefully, you
Yeah.
can see
Yeah.
that is the carpal tunnel,
Yeah.
right? So we talked about the carpal tunnel being a place where the nerve travels down the forearm and it goes underneath this band right here,
Mm-hmm.
but it's sandwiched underneath between the bones of the hand and the wrist
And
and
that
this top
band.
piece
Yeah.
of band or this ligament up here.
Mm-hmm.
And so when you have compression, swelling, or inflammation in that area, or just decreased space, then you can have compression on the nerve that can irritate it and cause numbness and tingling in the hand. So that kind of correlates with like issues in the wrist, carpal tunnel as being one of them. Um, so that's kind of the overall anatomy of the
Interesting.
wrist. If we add in the muscles, just so you can see it, all right, we zoom out. We
Yeah.
can see that most of the muscles, let me one more layer. I think that's it. Yeah. So you have lots of layers of muscles that live in the forearm. And you can see as we get into the wrist, you actually don't have any actual muscles. You don't see any red, right?
Right.
Do you notice
That's
that?
interesting. Yeah, I've never thought of
Right?
that or know that.
So the muscles pretty much end much higher up in the forearm here, and then they start back up in the hand. So these muscles in the hand are responsible for our dexterity, like the
Mm-hmm.
fine tuning, really precise movements that we use our hands for, texting, playing, manipulating the grip on your sticks, that kind of thing. Versus the muscles in your forearm are really what are the power generators, like kind of like what I was saying earlier. They really give us the force um, and the control of our wrist movements.
Yeah.
So, and then here in the wrist are just all tendons. So it's just all the tissues. Most of them, not all, but most of them travel under also that carpal tunnel area. You can see that a little bit better here. I zoom
Yeah.
in. It's kind of freaky. Happy
It
Halloween.
it is.
Um,
That was good.
Yeah, right? But you can see how all those tendons, as they come from the forearm, oops, sorry, as they come from the forearm, travel through that carpal tunnel area into the rest of the hand and the fingers. And so the muscles in the hand, we not going to spend too much time talking about the hand. We can do that another day. But most
Sure.
of the muscles in the hand also end in the palm. You actually
Mm.
don't have muscle bellies or red muscle bellies extending in too far
Right,
into the
into the
fingers
fingers. Yeah,
themselves. It's just tendons at that point.
yeah.
So that's really what we're talking about.
So interesting.
Is yeah, I mean, it's. I think a lot of not everyone, but a lot of people have that kind of misconception that we're just like solid meat sticks
Right.
in our arms. And some people it feels like that, but really, really
Yeah.
in terms of like our anatomy, it's this is kind of really what we're talking about here.
And does the lack of muscle in that area that you pointed out also make that more susceptible to injury because there's less cushion and meat around it?
Mm, I would say not as much as this spot right here, which I know we've talked about before in the past. This
Mm,
area
yeah,
right here, your funny bone,
yeah.
is probably more at risk for being susceptible to kind of damage or injuries because the ulnar nerve lives right in this spot right here, and there's really no padding what around it
Mm, yeah.
to protect that. And if we bend our elbow and we like bang it on something, like on a
Ah,
door or
don't
on a
remind
desk,
me.
like, and you feel that like
Yeah.
uncomfortable like achiness, like that's really the reason why. So I would
Yeah.
say that area probably more so than the wrist itself. There's not a pointy part of the wrist that will put a ton of direct pressure on that unless you're walking around like this, like
Yeah. What
which we
kind
might
of
need to have a discussion if you do that. So
what kind of therapy have you done with people who have had wrist injuries, whether it's a broken bone whether it's carpal tunnel, whether it's a strained ligament or other things that you've seen. I'm sure there's more than one answer depending on what the injury is, or maybe there's not.
Yeah. Yeah, it highly depends on what the injury actually is. So let's say, for example, someone fell and broke their wrist.
Hmm.
Typically, what we see is that the joints around the wrist get stiff. So they might lose mobility in their wrist in all the different directions that the wrist can do. If you think about what the wrist can do, it can go up and down, so flexion extension. It
Yeah.
can go side to side. Those are the main motions of the wrist. But if you break this radius bone that we were talking about, which is the most common, the radius, when it connects to the ulna, the other long bone in your forearm, that is responsible for the rotation of your forearm.
Right. And that's what he being the doctor that freaked me out said. And my break was, like I said, it was like if you took a round rock and just sawed right through it with a fine,
Oh,
it was literally
that's a
like
pretty
in
severe
half.
one.
Yeah, and that's why
Yeah,
he said you're gonna need screws, and I didn't end up. Next time he x-rayed me when I changed
yeah,
casts, only 2 weeks later, it was already really starting to heal really well, and like
yeah.
you said, I'm sure age and young bones had a lot to do with it. I think if I broke that same bone, you know, now my left ear would fall off, I'm not as together as I was then, but,
Well, it's interesting. Yeah, that's
I was
really, really
lucky considering
interesting.
the injury, the
Yeah,
extent of it.
I would say so. Because if you look at the bone itself, so kind of going back to your injury, the reason why that's so significant is you get a lot of rotation. So the rotation of the forearm happens both in two places, here close to the elbow and then down by the wrist.
Mhm.
And so the radius on this part, I think if I'm understanding you correctly, that's where you
No, it's
broke your
actually here.
Oh, yeah,
Up
sorry,
at the
sorry.
wrist, yeah.
Yeah, so yeah, so down here, they also need to rotate on
Yeah,
top of each
I was
other
gonna say
too.
just as pivotal of an injury. Badoo, psh.
Nah, haha. Um, yeah, so, uh, really, if someone breaks their bone, like, most commonly, like I said, the radius, the first order of business is to get the flexibility of the wrist back in
Mhm.
working order. And then depending on if they were in a cast or not, these days, coincidentally, um, doctors, and I don't know if this is just in like Southern California or if this is like nationwide, but the doctors that I've been seeing, or the patients of doctors who I've been seeing, they actually don't cast like a plaster
Oh,
cast anymore. They actually just put these people in like a typical wrist splint that you can buy
oh, like a
from the
brace, right?
drugstore. Yeah,
Wow.
so they put them in a wrist brace to immobilize it that way. And I think what they've done is they've looked at it, like they've researched it, and they found that perhaps that the amount of negative reactions or kind of adverse reactions or like worsening of conditions or non-healing was not any different if they were fully casted or not.
Interesting, wow.
Yeah, they've been doing a lot of studies that have looked at, okay, do you intervene or not, and what's the difference between the outcomes, like, at the end of the day?
Yeah.
And so the field of medicine, at least in orthopedics, has shifted a lot less conservative, like, because before people were, like your picture, cast it
Yeah.
from tip to toe, um, to immobilize it, and,
Yeah, there it
so,
is.
with
Full
the
cast. Crazy.
with the wrist splint these days, it allows people to be way more functional a lot earlier, and so they don't lose strength quite
Well,
as drastically as if you were completely casted. And then also because you're in a all the way up to your elbow, you probably had a lot of like stiffness potentially in the elbow once you had that cast removed.
I have a
Um,
question about that, though, and then we'll get to
mhm,
Scott's comments. Thanks, Scott Crockett. My question is a hard cast in any form still an option? And the reason I ask is I think about my lifestyle now. We have
mhm,
4 dogs and 2
yep,
cats, and if I broke my wrist now, I think I'd want it in a cast simply to
yep.
shield it more from any kinda impact or something.
Totally. Yeah, it is an option. It's not like they're like, "Oh, no, we don't have available." It is still an
Okay.
option. I think it should be at least, from an individual basis, right? Depending
Okay.
on what your situation is, and maybe you have, like, a banshee toddler running around, and you need to, like,
You
really
would
make
know.
sure that I would know, um, that you would just like what you said, either protect yourself from different scenarios that you already kind of foresee
Yeah.
happening, or if anything, and I tell people all the time, like, maybe it's not painful, maybe it's healing, but you need to warn people that, "Hey, I've
Yeah.
got this thing going on. Be careful."
Right.
And there's value in that. But I think when you get to the point where you're, like, casted from the wrist to the elbow, like,
Yeah.
that also has its consequences just by being in that position for, the month plus that you're in it.
Definitely.
So,
Yeah. For
you
the
kinda have
time I
to
had that full
weigh the
cast.
risks and the reward in that.
Yeah, it was like my elbow was so yeah, like,
Yeah,
oh my gosh.
and
And then
yeah,
just having the whole thing off eventually, even the half cast and starting to do this again, and
yep,
it
yep,
was a process.
yeah,
Let's go to Scott's comments. I'll put them in order. So Scott says, and by the way, folks, you can comment on any type of uh, motion, repetitive motion injury, or anything like that, and Janice will answer your questions. But he comments, first, I had carpal tunnel release, and then he opted for open release, less risk. His median nerve was severely compressed. And I also tore my bicep muscle. That sounds so
mm,
painful. Doctors performed a Mulford procedure. Drumming can be
yep,
hazardous to your health. My wife
yep.
says me drumming is hazardous to her health. But what what is the Mulford procedure? And that just sounds so painful, Scott.
Yeah, it's so a MOFA procedure is where they're attaching, if I'm not mistaken, they're reattaching the biceps tendon back
Oh, wow.
to yeah. Um and so they also MOFA procedure is also having to do with impingement of the shoulder joint. And
Uh-huh.
so, what they'll oftentimes do is kind of shave down the bone of the acromion. So that's like the hook part of the shoulder blade.
Yeah.
They'll shave the underside of that to create more space. Let me
Oh,
pull up my um, anatomy app again. So what we're talking about is here. And so, we're talking about this space. And then if we add some more stuff in here, blah, blah, blah. So there's a lot of stuff, oops, too far, that lives in this space. So
mhm.
here you have your biceps tendon here. And then here, if we spin around to the back, are all your rotator cuff tendons. And so all of those travel through this subacromial space, is what we call it in the PT world or in the medical world, all the
Mhm.
space. And so in some people, like this hook here, sorry, I'm like spinning around a lot.
That's okay.
So people have different variances of the shape of this portion of their shoulder blade. Some
Oh,
people are a little flatter, some people are a little bit more curved. So that will affect how much space one has in this area. And if they have less space, then the thought is that it will kind of impinge or pinch the tissues here a
mhm.
little bit more and then cause wear and tear over time. People who have rotator cuff issues, what we commonly see is because the rotator cuff helps move the arm, but then it also helps stabilize the shoulder. If those muscles aren't able to do their jobs in stabilizing the shoulder, then the biceps tendon oftentimes will, because that's kind of like the next best thing, but it's not really like the main job of the biceps to do that.
So
So,
interesting.
yeah. So there's a
Th
lot of stuff,
And while
so
you're
what
doing that, I just wanna ask Scott real quick. Scott, I'm curious, did you tear your bicep playing drums? And if so, what song were you playing? I'm curious, like, how you did that, or if it was more of an industrial accident or blocking a foot kick from your wife, like, what happened? He says that's exactly what happened to my shoulder. She's 100% correct. Absolutely. Yeah, let us know how you injured it. I'm really curious.
But
That
I've seen drummers specifically really injure their biceps tendon. I feel like that's really common. Um,
really?
it's not very common that you have a rupture from the top. If you do have like an injury from the top, more of what you're going to see is it's called a slap tear, like a slap tear, and
Mhm.
that's an acronym for superior labrum anterior to posterior. Fancy words, but basically, if you look here, the long head of the biceps. So biceps meaning two heads. You have one
Mhm.
head here and then one head here, but the long head attaches into this tissue here, which is called the labrum. And so if it is irritated or damaged, it can actually peel the labrum away from the shoulder blade, in the cup portion of the shoulder blade, which is where it lives. I've seen a well, that's kind of freaky. A couple of drummers that I've seen with like bicep ruptures actually is the distal end, so the bottom end where it crosses the elbow. This portion, I've seen a couple of ruptures of where this tendon will pull away, and then
Yeah.
call what we call you'll probably laugh when you hear this, but it's called a Popeye deformity.
Oh,
Because
wow.
basically, if you contract that muscle, the because it's no longer anchored to this
Yeah,
spot
it
right
stays
here,
like that?
it just balls up
Oh,
in your arm.
geez. Yeah.
That's why it's called a Popeye deformity, and that's a very classic sign for a biceps rupture.
Interesting.
So,
So to answer my question, Scott says, actually, here, I'll put it on the screen. Actually, it was raining and I dropped my hard case and I
mm,
tried to grab it mid drop and it yanked my arm. Well, that goes back to that can
ouch.
happen from a banshee toddler as well.
Mm.
Um, and then Graham Bates, who's commented on our show before. Hi, Graham. Thanks for joining us again. He says, hi again. I have pain in the top of my forearms, 3 inches to 4 inches up in my wrist bones. I stretch them before practicing, but a physio says don't. Is it possible he's stretching incorrectly? What's your take on that, Janice? That might be causing that injury.
So, if we're talking about 3 to 4 inches up the wrist bone, so probably right here. You can correct me if I'm wrong, Graham. So probably like right in through here.
Mhm.
Um, that is actually another area that's pretty common for drummers. There's a lot of different things, but probably the biggest culprit is it's a condition called de Quervain or de Quervain's tenosynovitis, and basically it's like an inflammation of the tendon of like the muscles that control this motion that pull up, and so
Mhm.
drummers in particular are susceptible to this depending on their setup, because if you are repeatedly going into this motion, these muscles are having to work eccentrically, meaning they're having to control how quickly your wrist is dropping down versus like if they were working concentrically, which is the opposite, then the
Right.
action of the muscle is to be pulling it upwards, but that muscle's having to contract as it's lengthening, which is an eccentric
More
condition.
stress.
So yeah, so that muscle's having to work while it's being stretched at the same time. So, there's a lot of different approaches for decor veins, if that is what it is. It's hard to know exactly, but it is very common in drummers. First of all, is like making sure that your setup is minimizing the amount of excursion that you have in through here. Um, and then stretching before the risk of that, if you stretch it before you play, especially if it's already bothering you, is that you could flare it up and then you're dealing with a already inflamed tissue while you're playing, which then could potentially make it worse.
Mm.
Typically, what we recommend, if you are going to do some kind of movement, so depending on if you're stretching, so there's a stretch where you hold it for a period of time, what we typically call like a static stretch,
Yeah.
where you're just holding it like your typical like 30 seconds, you hold it 30 seconds and you switch 30 seconds. If you stretch it in a static manner, meaning that you're holding it for 30 seconds or longer. Typically, what we see, not necessarily in a negative way, but it can impact muscle performance. It makes the muscle uh, performance dip just ever so
Mm.
slightly. Versus if you do kind of like a moving warm up, so you're stretching and you're kind of going in and out of the motion, but really not staying in that stretch position for a long time. That actually is safe. That's a dynamic warm up, and so
Okay.
there's a lot of benefits to that where you're able to, get some blood flow to the area or kind of get those tissues a little bit more resilient. So
Interesting. And Graham's also asking if you could spell, I think the word
decor veins,
dequervain. Yeah. How do you spell that? I'll put it
D-E,
in the chat. What is it?
yeah,
D-E?
DEQUERVAINS. Hang on, let me write that out and make sure that's right. I'm a visual person.
Yeah.
D Corvins things. Yeah. DEQUERVAINS. And then
R
tenosynovitis.
wait, I'm sorry. Back up real quick.
D
D-E-Q-U-E-R.
QUERV as in Victor
Uh-huh.
AINS.
A-I-N-S.
Yeah.
There we go.
And then tenosynovitis. But if you just type that in, the rest should pull
Okay.
up.
Cool. And thanks because I wasn't sure either what it was. And
Yeah.
I think you just answered this. Scott's asking what kind of exercises would you recommend? Oh, that we do for our bodies prior for more full body stretches, legs, torso, like what do you things that are dynamic stretches like that? Good.
Yeah. Total body is great. I encourage all drummers to stretch their hips, especially their hip flexors, because they use it a lot when they're playing too. And so, and they're sitting. So you're using these muscles in a very shortened position. So, any kind of stretch for like the front of your hip is super valuable. Any stretch for your torso, so kind of like a rotation stretch, you can do something like that, which is going to also be beneficial because you're not just playing straight here, you're having to reach, but you can use your whole body to reach. And so if you kind of move your torso
Twists,
and
yeah.
have that available to you to use, even if you don't use it, will just kind of help everything. So full body warm up before playing, especially for drummers, because it is such a full body experience.
Which is another great reason to hydrate as well, so your fascia is
Yes.
flexible and malleable.
Totally.
That helps.
Totally. Yeah.
Yeah.
So I would say, like, don't tell any other musicians this, but drummers in particular have quite a high physical demand, probably more so than the vast majority of other instrument players out there, at least for
Yeah.
for face value. So, that is something to consider, like even more so that you should be thinking about mobility and strength and your setup and all of those things. Not that other people shouldn't, but drummers
Right.
in particular.
Absolutely. Thanks. Any last questions for Janice before we go? Or I'll take your question and make up an answer and she'll correct me. Any questions about repetitive motion injury, arthritis, bursitis, tendonitis, carpal tunnel, neck pain, not counting a relationship, but neck pain from, anything like that, lower back, hips. Thankfully, my lower back issues are way, way in the past. I had lower
Knock on
back
wood.
pain for 10 years. Yeah, for sure. That was terrible. Strangely enough, though, it never bothered me when I played drums. Isn't that weird? Like maybe it was mind over matter or something, or it was so enjoyable to play that I blocked it out. I don't know. Or if the
Yeah.
natural dopamine or endorphins blocked out the so I don't know, but it never bothered me. Other than that, I walked with a cane for 3 months. I was so debilitated. This was in my early mid 30s and it lasted like 10 years.
Oh man, that sounds
Yeah.
awful.
And that's the
Nice.
sciatica that came with it, but it's long, long gone, which is great.
Good.
But
Good.
yeah, if there's no other questions, what we'll do next month, in case you don't know, folks, it's a once a month show. We'll go a little further in that area of the body. We'll talk about the hands, and I'm sure there are drummers that have had issues with hands, whether it's just arthritis because of age, or swelling because of maybe a day job, or just playing too hard, maybe. We'll talk about that and the vibrations that go through from how you play. Janice, I don't remember if we have a date. You want to just pick one real quick, or do we have one? Steve will
Sure.
yell at me and on the phone if we already have one.
I don't know. Maybe not. We'll see.
17th, October 17th.
Sure.
And that's at noon Pacific. I goofed earlier. Sorry, everybody. So, folks,
okay. Set.
Plan think of how you feel when you play. Think of how you feel after you play. Even if you're a piano player, keyboard player, guitar player, anything where you move, fine motor movements to big movements, think of how you feel. And sometimes, we do a gig and we got these little ailments, but then, there's a little party afterwards. You do all this, you get your gear, and 3 days later, you kind of don't remember. So it's almost like a car accident or something like that. You remember the details more freshly as soon as it happens, but as time goes by, you remember it differently. You don't remember. Pay attention to how you feel while you're playing and after you play, and make a little note of something you might want to ask about on the show.
Yep.
Great. And Scott, thank you so much. Scott Pistol Crockett says, I love this. Very helpful. Thank you. You can look up this show on YouTube and Facebook on the playlist. And there's episode upon episode upon episode upon episode. And I don't see us stopping anytime soon. So there. Thanks for putting up with me and welcoming the wonderful returning Janice Ying every month, who I love sharing that anatomy program and really being able to see what's going on,
I mean, we weren't born with the instruction manual, so it's nice to kind of see
that's right,
under the hood, right?
Yeah. And thanks for getting a degree for us.
You are welcome. Just for you, Dan, just for you.
And Scott says, I like her because she said I was her favorite drummer. And Graham as well. Thank you. Thanks everybody for watching, whether you're watched live on YouTube and Facebook, or whether you're watching on the archive on either of those, Vimeo, X, or Instagram. Thanks everybody. We'll see you soonish. Well, in a month. You'll see me.